Hi, it's the nursing professor here. Are you planning to take the NCLEX anytime soon? If so, I got 5 tips that I think will really help you out with you being successful on NCLEX. So number 1 is, these are common mistakes that students often make, is that you read too fast. Slow down, read the question, understand what the question is actually asking you. Because when you read too fast and you jump ahead, you're given the answer of something that's not being asked with that particular question. All right, so slow down. Look for words that are clues like first, best, priority, immediate, because those words will give you a clue that that is the answer that they're looking for. All right, pay attention to that. Number 2 is choosing the most complicated answer. Usually that's not right. All right. Nursing questions are designed such that they want you to choose the safest action, not the most complicated one. All right. So slow down when it comes to that and don't think that that's necessarily the right answer. All right, so let me just give you an example of what that might be. If you're given a question and it asks you about nursing interventions, and one of the answers is teach a low sodium diet, you can do that. A nurse can do that. Don't need a doctor's order or anything like that. So usually that would be the answer. Okay, so don't necessarily think it's about getting an EKG or giving medications or any of that, unless, of course, the question is more about an immediate response. But if it is about a nursing intervention, usually it's about teaching. Okay, number 3 is don't ignore assessment before action, because the truth is this: you can't do anything without assessing the situation first. You cannot. You can't. Even if it's one, it feels like one and the same. Because how would you know what to do, right? Think about that. How would you know what to do? And so if the airway is compromised, you had to assess that the airway was compromised. If the person was bleeding, you had to determine they were bleeding before you actually tried to apply pressure. So don't ignore the importance of assessment. And remember, that's the first step of the nursing process. Number 4 is answering from real life experience. Nursing questions don't care about your real life experience. They just do not. So stop it. You have to put those things aside, because frequently theory doesn't match real life practice. Just gonna put it out there. It's the truth. So don't do that. Make sure you're answering questions from theory, what you've learned to do, and not from your personal experience. All right. Number 5 is changing answers. Usually, statistics show that the first answer that you chose was the correct answer. So unless you have some reason that will support you changing your answer, leave it alone. All right? So I hope those 5 things really help you be successful. Let me know if you pass your NCLEX, and I wish you all the best. I'll see you next video. Bye for now.